what does dextrose do? If it can proliferate, does it make normal tissue when it does so, or does it make bad tissue or scarred tissue? Well, first of all, scars have never been demonstrated, but let's look at some studies on individual changes that dextrose does to prove this is normal tissue. First, it tightens. Now, let's explain this a minute. When proliferation happens, the tissue is laid down in parallel with the tissue that's already there. And as it matures, this tissue tightens end to end. And that's how we repair after injuries. We lay down new tissue and then it tightens as it matures because that tissue dehydrates as it matures. So I took that information that I expected that dextrose would tighten things, and I looked at knees that were either loose with the anterior cruciate ligament, ACL, or in which it was absent. I measured looseness in the knees by an arthrometer is what it's called. This was a KT1000, the most commonly used arthrometer. This provides a beep because what you're doing is an anterior drawer test. You're holding the lower part of the leg forward, and then when you reach an exact force at an exact angle of the knee, which is reinforced with a bolster, specially designed bolster, and then you hear a beep, and then you read that millimeter reading, and you do it on both sides. And this is important because people vary in their own looseness of the knee, and to determine if an individual knee is loose, you measure something called the anterior displacement distance and the difference between sides. So if there's a 4 on the left, a 2 on the right in millimeters, that's a 2 millimeter anterior displacement distance. I took 18 consecutive patients with 6 or more months of knee pain and ACL laxity as measured by this machine. And my requirement for proving laxity was greater than equal to 2 millimeters. Of these 18, 13 also met criteria for osteoarthritis. I took these patients and I injected dextrose every 2 months through 6 months, and then at 10 and 12 months, and by request, through 36 months. With the KT1000 measured at 0, 12, and 36 months. I had one tester for consistency who also assigned the participants, and that can introduce some bias. But that was decreased, or that effect was minimized somewhat, because the anterior displacement distance was tested before other data was obtained. And at follow-ups, the data as to which knee was treated with dextrose previously was not viewed prior to retesting of these knees. So here is the result. Of the 18 patients, 1 withdrew due to disseminated cancer, and the second lost the ability to travel to the clinic. That left a capture rate of 18%, or 16 out of 18 to 3 years. A very high capture rate. Of particular interest is that 9 of 16 at 1 year and 10 of 16 at 3 years no longer tested as lax. So their anterior displacement distance was now less than 2. Along with this, despite the apparent tightening, the joints showed more flexibility and pain reduction occurred. And you can see the range of motion improved by 10.5 degrees and the pain of walking decreased by 43%. But if you look at the red here, this is the group of patients in the black who had osteoarthritis and an ACL tear. This is the group I have available to show the changes. And of interest is that when you use this arthrometer, if you measure a 3 or more, the patients are 90% likely to have a complete ACL tear. So among these patients, there were 3, 4, 5, 7 that had a likely ACL tear, or perhaps 6 of 7. And you'll notice in the gray that after treatment, many of these patients, or multiple patients who had apparently a complete ACL tear, still tightened to the point that they did not measure as loose by the anterior displacement distance between sides.